Hello, and welcome to the ICT4D conference podcast. My name is Sonja Ritzel from CRS, and I'm interviewing experts for you to talk about digital development trends, innovations, and good practice. Today I have the pleasure to speak with Dr. John Reeder. John is the Director of TDR. That's the Special Program for Research and Training in Tropical Disease based at the World Health Organization. Thank you so much for joining us for the first interview in our new mini-series on ICT4D and malaria, and providing us with an overview on the digital technologies used globally to help fight malaria and their potential as well as challenges. Welcome. John, would you like to introduce your work at TDR to give us an idea of the organization?
Thanks, Sonja, and pleasure to be here with your listeners. So TDR has been around about 45 years now with twin aims. The first of those aims is to provide better tools to counteract the threat of infectious diseases and poverty, so the diseases that are disproportionately affecting low and middle income countries. The second element of this is the realization that in those countries, there's often weak infrastructure for research. So supporting the scientists in those countries to build capacity to perform research that improves the health in their own countries are our key aims. Over the years, the way we do this has changed quite a lot. We would have started very much about trying to develop drugs, develop vaccines, develop diagnostics. Very much we've moved into then how we make sure those products get used and have the effect that they potentially could have. So we've moved into areas like implementation research and community-based actions over time. And of course, part of that now in the current times is thinking very carefully about digital health as well. And already we've got quite a track record of applying digital health in areas like TB, where we've been working in West Africa, looking at how to better implement action against drug-resistant TB, and also providing implementation research tools to be used in looking at implementation of TB programs. Of course, this is spread into many of our other programs as well, like the massive online open courses that we're doing for implementation research, and even new modules such as issues like gender intersectionality and gender and research.
Thank you so much for the overview. And John, what are the main digital technologies used in malaria programming? So why should we encourage our organizations and our global partners to embrace more digital tech and data in our work?
Well, interestingly, we've just conducted, and this was just in March this year, and the preliminary results coming in, a quick survey looking at online self-filling questionnaires amongst the national malaria programs in 14 West and Central African countries. And in these preliminary results, we started to see some really interesting trends. Top 4 digital tools that we're seeing used in the national malaria programs are related first to case notification, so surveillance. Secondly, to monitoring seasonal malaria chemoprophylaxis, so then trying to get effective protective measures. And thirdly, to do looking at data repositories at a national level, so there's better information. Interestingly, though, fourth on that list is not isolated to malaria and is quite common in many diseases, and that's tools that help stock management and procurement of equipment and medicines, which of course is a very practical underpinning of any intervention to any disease.
Thank you. Now, that's obviously the importance of the digital technologies, but what do you see as the main challenges or the main barriers when applying digital technologies in our space, digital health, but particularly in the fight against malaria?
Well, this was another question we asked the people in the national malaria control programs. And I think obviously that's where we really need to be listening to the needs. We came up with 4 areas that were most frequently cited as challenges that they think could be improved by a digital solution. The top of that list are tools that improve availability of qualified health workers. So how can you make sure there's access to good health advice? Also, how can you ensure regular supply of the commodities you need to control malaria? The second of the tools was for tools that improve data quality and reporting of data. Because of course, if you're not getting accurate reporting right from the ground, then the figures you start to see at regional and national levels mean nothing, and it's very difficult to measure response and measure success. Third along there were tools that improve patient care quality. So addressing areas like health worker adherence to guidelines, the motivation of health workers, improvement of health worker competence, and improvement of supportive supervision of the health workers. So really trying to assist the health workers do their jobs as well as can be done. And finally, in that list, there was a need for tools that improve patient treatment adherence and improve access to healthcare and timely provision of that care.
Thank you, John. What is your call to action for the global malaria and ICT4D community to overcome those barriers in the future?
I think first let's talk a bit about some of the main barriers that we're seeing when we're applying these digital technologies. Because we found when we were asking around that issues like the cost of rollout of activities is the most frequently cited barrier in introducing a digital tool. So simple cost, being able to afford to roll out the digital tools. The second, and sadly, while we tend to take for granted that we can get access to internet everywhere, it's the second most frequent barrier that was cited in the study was lack of reliable connection to the internet. And a third on that is the lack of coherent national digital health strategies. And this was in over half the countries we looked at didn't have a national digital health strategy. So these were real barriers. But one of the areas that I really am interested in from TDR's point of view is when we identify the key issue of the lack of evaluation of the programs done by the national malaria programs. We see that there's a real lack of need for assessment surveys to precisely define the malaria problems and to overcome those problems and provide the tools that could potentially bring solutions. And secondly, when implementing new tools, there's a real lack of implementation research to measure the feasibility, acceptability, effectiveness, or even cost effectiveness of moving to digital solutions. So we're making assumptions that digital solutions are good, but we're not getting the proof to be able to justify that assumption. So my call is really for solid evaluation data and implementation research that proves and supports scale up of these digital technologies. We need to know what works, we need to know what doesn't work, and we need to know how to improve and scale up the successful programs so they can really make a health impact. And during the conference, TDR presenting some of the results I've talked about and discussing it with the National Malaria Program coordinators. And I think we need to work together to solve these issues to make sure that digital technology really makes an impact on malaria control and elimination in the future.
Thank you. You're right. We need to know what works and what doesn't work, and we need to tell each other as well our lessons learned. And I'm so glad you mentioned the conference, because that was my call to action for our audience to register for our upcoming virtual conference on ICT for malaria elimination on April 27th and 28th. Featuring numerous discussions over 2 days on various topics around digital technologies in malaria programming, as well as a session by John's colleagues. Thank you so much for sharing your insights. Do you have any other closing comments or anything you would like to share?
I think my final word is that there's huge potential in digital technologies. And what we've really got to make sure is there's equity in the application of those technologies, that we make sure we're putting these tools in the hands of implementers at a grassroots level to really effectively address the issues of diseases of low and middle income countries, and make sure that digital technology works for everybody. Nobody gets left behind in the digital revolution.
Well said. Thank you for joining us today and sharing your work at TDR and the World Health Organization. Thank you, John.
Thanks, Sonia. Been a pleasure.
More information about our upcoming podcasts or webinars are on our website, ICT4dconference.org.